So what we're going to be talking about today is the anatomical positions that our body gets into when we are under stress. Okay? When you guys are working with your athletes, what we're trying to do is stress them to the point where we get to see when the wheels fall. Okay? Knowing when we can put them back in that position and create the adaptation for change, build strength, build muscle, everything that we want to do in this gym. Okay? So very first, we'll start out from the top and work our way down. Okay? So everybody, give me a gun. Good, awesome. Now take this gun, take the thumb, put it right here at the top of your sternum. Now look straight ahead. This is neutral spot in your cervical area. This is our neutral neck. Okay? From this position, you can turn left and right. Good. Straight ahead. Now you have some lateral flexion, so touch your left ear to your left shoulder. And right to right. Good work. Now look straight ahead. You can also extend. Look up at the ceiling. And you can also flex. Move the gun, touch your chin to your chest. Perfect. Look back up. Where we see this is anytime that they are under load, doing deadlifts, doing squats, doing anything where they can manipulate here. Okay? Where's the problem? Deadlift. Okay? Let's say we are deadlifting and we start to look up. Well, what's going to happen is that's going to break off all the way down the chain and start from your cervical spine and move down to your thoracic and then finally to your lumbar, to where you are now arching up and creating this horrible position with your lumbar spine. Okay, so maintaining that neutral cervical spine will be nothing but beneficial. Anything with the squat, as we're moving, we want to be looking ahead. We don't want to be looking down because now we're rotating forward on our toes and we're not getting a good push through the floor. Good, fantastic. Now we're going to move down. There's two aspects of our shoulder. We have our shoulder girdle, which starts with our scapula and your rotator cuff muscles and all the movements that your scapula can do. Then we have our glenohumeral joint, our shoulder joint, down through here. Thinking of these as two separate issues is how we need to build this foundation, because the foundation is going to come from your scapula and all those movements and all those stabilities before we start moving out in space. Okay, so with the scapula we have elevation and we have depression. Good. We also have forward and back, so we have protraction, yes, and we have retraction, yes. How many athletes do we see that are bulldogs? Hi, how's it going? Yeah, lots of them. Yes. Some, for sure. Yeah, so what they're doing is they are protracting across. Okay? We talk about the perfect storm when we're looking at people with shoulder issues and bad mechanics through their shoulder. Elevation, protraction, and then we add internal rotation to the glenohumeral joint. Yeah, this is bad. Just go ahead and hang out here. Okay? Now, watch how this translates super easy into things you've seen. I know as CrossFit coaches we don't get a lot of bench, but oh yeah, the guys at the gym repping out their bench way up high, just torching their shoulder. The problem with this is you're elevating and you're pulling across, so now you've taken your rotator cuff, bent it around a corner, and then slammed all of your rotator cuff tendons underneath your AC joint as it's elevated up here. And it's angry, okay? Add to that internal rotation, now there's nothing protecting the glenohumeral joint in the back. We don't want that at all. We want this solid foundation for them to push, pull, okay? If we move to the glenohumeral joint, I want to make one huge thing here, okay? Everybody take your hands and go right here. Good. Now internally rotate by touching your tummy. Good. Then externally rotate going out. Okay, good. In sports, you see it all the time. Internal rotation, external rotation. Okay? When we look at the whole shoulder as one, hold your arm out here. Good. Now, moving the head of your humerus in towards the midline, internal rotation. Good. Come back. Don't move the upper part at all. Just move at the elbow. This is supination and pronation. We don't want this, okay? When we tell them to externally rotate or apply torque to the bar, people that are doing this are opening up doors, okay? We don't want this. We want them to externally rotate, pull down. Good, setting their shoulders. So, everybody put your arms straight out. Moving your thumb towards the midline, internal rotation. Moving it away is external rotation. Yes, good. It can happen out here. Yes, it can happen out front. In ways that you're going to see it, like I said, you don't guys do a lot of bench where we ask them to torque that bar down, but where else could you see it? Let's go up. Okay, snatch. Okay, yeah, getting away, getting that external rotation, but also press. Push press, jerk, anything like that. The people that immediately go to initiate movement by shrugging it up, well, there's elevation, yikes. Okay, then they protract and they internally rotate to get some force on the bar, yikes. Okay, everything is smashed through here. If everybody stays here and keeps that external rotation on the bar, yeah, now they're pulling their shoulders down and keeping it in a good stable position to push up over their head. Okay? So teaching your athletes the difference between internal and external rotation and the pronation and supination of the wrist to apply torque to the bar. Okay, really get them to set their shoulders down. Okay, so we also have the flexion and extension, curls for the girls. Good. All right, we'll move down just a little bit. We'll talk about your trunk. Take your thumb, put it right at the base of your sternum. Take your other thumb, put it right in your belly button. Now they should be parallel. Okay, so when we increase the angle, we extend. Yikes, low back problem. Yes, come back. When we flex, good. That hollow position is a little bit of that flexion, trying to decrease that angle. Okay? We don't want you all the way up and curled, but that's a good way to teach them how to actually activate their trunk to curl up instead of using their hip flexors or their shoulders to bend themselves. Okay? So you've got that. Good. Yeah. Right below it, you've got your hips. These are my bread and butter, my money maker, where I just slaughter people's mechanics. Okay? So let's take the typical basketball player, soccer player, CrossFit chick. Anterior, posterior tilt. Anterior tilt. Bam! Everything's spilling out the front.
Rachel.
The anterior superior iliac spine and your posterior superior iliac spine should maybe have a difference of about 8 degrees. Okay? Lots of athletes that we see that just play basketball, just play soccer all day long, that repetitive all the time, they get this high ass syndrome. Okay? Weak hip flexors, tight hamstrings, pinched lower back. They might not manifest with any issues, but they're just setting themselves up for it. Okay? What we want to do is just kind of fire the hips, pinch your butt cheeks, keep everything nice and stable. Reggie, my cameraman, talks about prison defense, getting at the end of your clean, at the end of your squat, that prison D just, whoa! It's a little too much, okay? That's the end of a powerful range of motion. Right now what I want you guys to think about is, if you're in an elevator and you have to fart, okay? Yeah. Just pinch it off a little bit. You don't want other people to see you straining, like, oh my god, that guy's holding a fart. Get me out of here! Get me out of here! No, just a little bit. Just stand there, hold in your fart. Okay? Everyone want to fart? Yeah. Good, all right. Now, when we're looking at other aspects of the hip, issues with flexion and extension, abduction, all those things don't really manifest itself until they really start moving, running, stuff like that. Where you guys are going to see it is squats, cleans, anything that is close kinetic chain, pushing through. Okay? So what I want you to do is I want you to make your leg as stable from the hip to the knee to the toes. Okay? And I want you to internally rotate your feet. Good. Now externally rotate your feet. Good. Back to the front. You're not going to see a lot of issues with them when they're standing, but get a little bit of adduction, like when you're squatting, when you're lifting, or anything else. When I internally rotate my femur, that's horrible. We see this all the time with people squatting. Yeah, I tell people that's $40,000 in a 365-day knee. Okay, because you're putting all this strain on the medial aspects of your knee. You're letting go of your hamstrings. They're not engaging. They're working to stabilize your ACL and your femur and tibia front to back, and they're not being the prime mover. So, if you see people that are cooked this way, tell them to externally rotate your femur. Okay? I personally have this problem like the snowboarder stance. Where you're out here, and you look like you're nice and stable, but you're not. See where my kneecaps are? They're knocking you guys out right now. Okay? So I've got a little too much external rotation in my fingers. Bring it in. Now I'm still in a good athletic stance, I'm still in a good squat stance, but my knees are now tracking properly where they're at. So if you see people with this problem, you can tell them, hey, this is internal rotation, this is external rotation, and then how they can apply that to